Now we came to the tympanic part of the temporal bone. The tympanic part is visible on the inferior view. This triangular bony plate structure is the tympanic part, and it has three borders and two surfaces. The three borders are the superior border, inferior border, and the lateral border. And the two surfaces are the anterior surface and the posterior surface. First, we will begin with the borders. The first one is the superior border. The superior border is related to the interior part of the mandibular fossa. As we previously discussed, this is the interior part of the mandibular fossa. And this interior part of the mandibular fossa is the squamous part of the temporal bone. And this is the superior border of the tympanic part, related to the interior part of mandibular fossa. Next is the inferior border. Medially, the inferior border is related to the petrous part of the temporal bone, and posteriorly it is related to the mastoid part. Along the course of the inferior border, it will split to enclose the styloid process, as you can see. This is the styloid process, and the inferior border split to enclose the styloid process. Next is the lateral border of the tympanic part. This is the lateral border on the inferior view. Now if you get to the lateral view, this is the lateral border on the lateral view. And since this is the posterior surface, so the lateral border along with the posterior surface will form the interior wall, the floor, and the lower half of the posterior wall of external acoustic meatus. Posteriorly, this lateral border will merge with the mastoid part, and between these two parts there is present a fissure called the tympanomastoid fissure. Next is the two surfaces of the tympanic part. First one is the interior surface. On the lateral view, this is the interior side and this is the posterior side. So this surface of the tympanic part will become the interior surface. The interior surface is more clear on the inferior view. This is the interior surface on the inferior view, and it is related to the mandibular fossa. It forms the posterior non-articular part of the mandibular fossa, while the interior articular part of the mandibular fossa is formed by the squamous part that we discussed previously. Next is the posterior surface. The posterior surface can only be visualized on the lateral view. As discussed previously, the posterior surface along with the lateral border will form the interior wall, the floor, and the lower half of the posterior wall of external acoustic meatus. Along the medial aspect of the posterior surface is present a sulcus called the tympanic sulcus, which lodges the tympanic membrane. Now we came to the fissures related to the tympanic part. There are two important fissures that you should know. First one is the squamotympanic fissure, also called as the Petrotympanic fissure or Glycerian fissure. This fissure is present between the squamous part and the tympanic part. And to be more specific, this fissure is present between the anterior part of the mandibular fossa and the posterior part. This fissure connects the middle ear cavity to the mandibular fossa. In the lateral view, over here is present the middle ear cavity, and this is the squamotympanic fissure. Structures such as vessels and nerve passes between the middle ear cavity and the mandibular fossa through the squamotympanic fissure. Next is the tympanomastoid fissure. This fissure is present between the tympanic part and the mastoid part. In the inferior view, this is the tympanomastoid fissure. You can also see this fissure from the lateral view. This is the tympanomastoid fissure in the lateral view. The auricular branch of vagus nerve will come out from here and will supply sensory innervation to the skin of the ear canal, the tragus, and the auricle. There is clinical significance associated with the auricular branch of vagus nerve. Stimulation of the auricular branch of vagus nerve by matchsticks or by putting cold water in the ear lead to bradycardia or even heart block, causing death of the person. This is because of the fact when vagus nerve is stimulated, it also has innervations on the heart. That is, it has inhibitory effect on both SA node leading to bradycardia and AV node of the heart, leading to blockage of the heart conduction system. These two effects can lead to death of the person. Now we came to the petrous part of the temporal bone. In complete skull model or in the lateral view of the individual bone, you cannot see the petrous part of the temporal bone. In individual bone, you can see the petrous part in the posterior view. This is the petrous part of the temporal bone. It is pyramidal in shape, and that is easy to remember. P is for petrous part and P is for pyramidal shape. It has a base which merge with the inner surface of the squamous and mastoid part, an apex and three surfaces, that is the interior surface, the posterior surface and the inferior surface. And it has three borders. The superior border present between the interior and posterior surface. The interior border present between the interior and inferior surface. And the posterior border present between the posterior and inferior surface. First we will begin with the base. The base of the petrous part merge with the internal surface of the squamous and mastoid part. Next is the apex of the petrous part. The apex is blunt, directed forward, medially and slightly upward. In this view you can clearly see that the apex is directed anteriorly, medially and superiorly. In complete skull model, you can see that the apex is related to the body and the greater wing of the sphenoid bone. The apex of the petrous part and the sphenoid bone together form a foramen. This foramen has lacerated margins and is called the foramen lacerum. The apex of the petrous part shows an opening of the canal called the carotid canal. The carotid canal starts from the inferior surface. This is the opening end of the carotid canal. This canal has a curved course and end at the opening of the apex. The main structure that passes in the carotid canal is the internal carotid artery. It enters the carotid canal from the inferior side. This curved course of the internal carotid artery represents the curved nature of the carotid canal and leave the carotid canal at the apex. And by leaving the carotid canal through the apex, it enters the skull. As you can see, the internal carotid artery entering the skull through the carotid canal. A ligament called the petrosphenoidal ligament, also called the Gruber's ligament or Petroclinoid ligament. One end of the petrosphenoidal ligament is attached to the apex of the petrous part, and the other end is attached to the lateral border of the upper clivus of the sphenoid bone, behind the posterior clinoid processes. Since one end of this ligament is attached to the apex of the petrous part and the other end is attached to the sphenoid bone, that's why it is called the petrosphenoidal ligament. These are the posterior clinoid processes. Behind this is the clivus, and the petrosphenoidal ligament is attached to the upper part of the clivus. That's why it is also called the Petroclinoid ligament. This is the posterior zoom-in view of the temporal bone. This is the apex of the temporal bone, and this is the body of the sphenoid bone. These two are the petrosphenoidal ligament. This is the clivus, and as you can see, the petrosphenoidal ligament is attached to the upper part of the clivus. This is the gap between the petrosphenoidal ligament, the apex, and the body of the sphenoid bone. And this gap is called canal. In the canal passes two structures, that is the abducent nerve and the inferior petrosal sinus. And after passing through the canal, both of these structures enter the cavernous sinus. In this model, this is the cavernous sinus. There is present the petrosphenoidal ligament and the canal, which I have not shown in this model. This is the abducent nerve passing through the canal and entering the cavernous sinus. Now if I made the cavernous sinus slightly transparent, then you can see the abducent nerve entering and leaving the cavernous sinus. Same, this is the inferior petrosal sinus and it passes through the canal and join the cavernous sinus. Next is the three surfaces of the Petrous part, starting with the interior surface. The interior surface has the following important structures: trigeminal impression, trigeminal prominence, meatal depression, arcuate eminence, Tegmen tympani, and the two hiatuses. One is hiatus for greater petrosal nerve and the other one is the hiatus for lesser petrosal nerve. First we will discuss the trigeminal impression. Just next to the apex, the interior surface shows a depressed area called the trigeminal impression. And in this depression is present the trigeminal ganglion. As you can see, this is the trigeminal ganglion present in the trigeminal impression. Since this impression on the interior surface is created by trigeminal ganglion, that's why it is called trigeminal impression. Next, lateral to the trigeminal impression, there is a small bony elevation called the trigeminal prominence. In this image, this is the trigeminal impression. And next to it is this small bony elevation called the trigeminal prominence. Lateral to the trigeminal prominence is present another depressed area called the meatal depression. In this image, this is the meatal depression, and as you can see, it is present lateral to the trigeminal prominence. The meatal depression form the roof of the internal acoustic meatus. The internal acoustic meatus is actually a canal, and the roof of it form a depression on the interior surface called the meatal depression. It is called meatal depression because the meatal is related to the internal acoustic meatus and depression mean it is a depressed area. Lateral to this depressed area is present an elevated area called the arcuate eminence, and this arcuate eminence is produced by anterior semicircular canal. In this image, this bony elevation is the arcuate eminence. Now if I remove this eminence, then underneath it is the anterior semicircular canal. This is another radiographic image. Here this is the anterior semicircular canal and you can see the bulge created by this anterior semicircular canal on the interior surface. And this bulge is the arcuate eminence. It is called arcuate eminence because this small part of the anterior semicircular canal which create this eminence is like an arc. So the word arcuate represent the arc and eminence mean it is a bony elevation. Lateral to the arcuate eminence and medial to the internal surface of the squamous part is present Tegmen tympani. Tegmen tympani is a bony plate and it forms continuous roof on the tympanic antrum, middle ear cavity and the bony part of the eustachian tube. Deep to the Tegmen tympani, posteriorly is present tympanic antrum. Anterior to the tympanic antrum is present the middle ear cavity. And anterior to that is present the bony part of the eustachian tube. Now if I show you the cross section of this part, then you can clearly appreciate that Tegmen tympani form continuous roof on the tympanic antrum posteriorly, the middle ear cavity in the middle, and the eustachian tube interiorly. In the interior view, this is the opening of the bony part of eustachian tube. Next is the two hiatuses, that is hiatus for lesser petrosal nerve and the hiatus for the greater petrosal nerve. Both of these hiatuses originate from that part of the Tegmen tympani which form the roof of the middle ear cavity. Both of these hiatuses run toward the medial side. The hiatus for the lesser petrosal nerve lead to the foramen ovale, while the hiatus for the greater petrosal nerve lead to the foramen lacerum. The hiatus for the lesser petrosal nerve is anterior and has a short course, while the hiatus for the greater petrosal nerve is posterior and comparatively has a long course. As the name suggests, the hiatus for the greater petrosal nerve will lodges the greater petrosal nerve, and same, the hiatus of the lesser petrosal nerve will lodges the lesser petrosal nerve. So the lesser petrosal nerve will get out of the medial ear cavity through the roof, via the hiatus of the lesser petrosal nerve. It will run to the medial side and will reach the foramen ovale. Same, the greater petrosal nerve will get out of the medial ear cavity through the roof via the hiatus of the greater petrosal nerve and will continue to run on the medial side and will reach the foramen lacerum. Next is the posterior surface. On the posterior surface is present four important landmarks, that is the internal acoustic meatus, subarcuate fossa, aqueduct of vestibule, and the sigmoid sulcus. First one is the internal acoustic meatus. The internal acoustic meatus is about 1 cm in depth and it allows passage of three important structures: facial nerve, vestibulocochlear nerve, and labyrinthine artery. Lateral and superior to the internal acoustic meatus is present a depressed area called the subarcuate fossa. And the subarcuate fossa lodges some folds of the dura mater and the blood vessels. Below the subarcuate fossa is present an oblique slit. This oblique slit is called aqueduct of vestibule and it lodges the endolymphatic sac. This is the endolymphatic sac present in the aqueduct of vestibule. The most lateral of the posterior surface merge with the internal surface of the mastoid part, and at their junction is present sigmoid sulcus, and in the sigmoid sulcus is present the sigmoid sinus. Next is the inferior surface of the Petrous part. The inferior surface of the Petrous part is rough and irregular in nature. Anteriorly, it is related to the greater wing of the sphenoid bone, and posteriorly, it is related to the occipital bone. On the inferior surface is present the following important landmarks: the rough quadrilateral area, carotid canal opening, jugular fossa, petrosal fossa, tympanic canaliculus, mastoid canaliculus, articular facet of the jugular process, pyramidal notch, cochlear canaliculus, and the stylomastoid foramen. First one is the rough quadrilateral area. Near the apex, the inferior surface shows a rough quadrilateral area. Next is the carotid canal opening. Lateral to the rough quadrilateral area is present carotid canal. The carotid canal lodges the internal carotid artery. The internal carotid artery will enter the carotid canal from the inferior surface and will come out at the apex that we previously discussed. Next is the jugular fossa. Posterior lateral to the carotid canal is present a depressed area called the jugular fossa, and this jugular fossa will form the interior wall of the jugular foramen. This is the jugular foramen, and the interior wall of the jugular foramen is formed by the jugular fossa of the Petrous part, and this jugular fossa lodges the superior bulb of the internal jugular vein. Next is the Petrosal fossa. Petrosal fossa is a small depression located in the ridge between the jugular fossa and the carotid canal opening. Number 5. The tympanic canaliculus. A small foramen present between the carotid canal and the jugular fossa is called tympanic canaliculus. And this tympanic canaliculus lead to the middle ear cavity inside. Next is the mastoid canaliculus. If you closely observe the jugular fossa, you will see 1 to 2 small foramina, and these are called mastoid canaliculus. Number 7. Articular facet of the jugular process. Lateral to the jugular fossa, there is an articular facet, and it will articulate with the articular facet of the jugular process on the occipital bone. This is the occipital bone. These are the jugular process, and on the jugular process of the occipital bone is present articular facet, and it will articulate with the articular facet on the temporal bone. As you can see, the two articular facets articulating with one another. Number 8. The pyramidal notch. Posterior to the carotid canal, there is a notch called the pyramidal notch, and this pyramidal notch lodges the inferior ganglion of the glossopharyngeal nerve. This is the inferior ganglion of the glossopharyngeal nerve present in the pyramidal notch. Number 9. The cochlear canaliculus. At the apex of the pyramidal notch is present a foramen called the cochlear canaliculus. Number 10. The stylomastoid foramen. On the inferior surface between the styloid process and the mastoid process, there is present a foramen called the stylomastoid foramen. And in the stylomastoid foramen passes two important structures. Number 1, the facial nerve, and number 2, the stylomastoid branch of the posterior auricular artery. The stylomastoid branch of the posterior auricular vein also passes in the stylomastoid foramen, just like the artery. Next is the three borders of the petrous part. First one is the superior border. The superior border is present between the interior surface and the posterior surface. The superior border provides attachment to the tentorium cerebelli. This is the tentorium cerebelli attached to the superior border of the petrous part. Also, near the apex, the superior border shows a notch. This notch in the superior border is created by sensory and motor roots of the trigeminal nerve. This is the sensory root of the trigeminal nerve, and behind it, this is the motor root of the trigeminal nerve. Now if I remove it, then you can see that both of these nerve roots has created a notch on the superior border. Next is the interior border. The interior border is present between the interior surface and the inferior surface. The interior border is related to the posterior border of the greater wing of sphenoid bone. This is the sphenoid bone. This is the greater wing of the sphenoid bone, and this is the posterior border of the greater wing. And as you can see, it is related to the interior border of the petrous part. Next is the posterior border. The posterior border is present between the posterior surface and the inferior surface. Medially, the posterior border is related to the basi-occiput. As you can see, medially, the posterior border of the petrous part is related to the basi-occiput. Laterally, the posterior border is free and form the interior boundary of the jugular foramen. This is the jugular foramen, and the interior boundary of the jugular foramen is formed by the free margin of the posterior border, as explained previously. Next is the styloid process. Styloid process is also called styloid part of the temporal bone. It is related to the inferior surface of the temporal bone. The inferior border of the tympanic plate split and it enclosed the styloid process. It is long, cylinder-like bony spicule, approximately 2.5 cm in length. It is directed inferiorly, anteriorly, and medially, and it provides attachment to three muscles and two ligaments. The three muscles are the styloglossus muscle, stylohyoid muscle, and stylopharyngeus muscle. Next is the two ligaments. First one is the stylohyoid ligament. This is the stylohyoid ligament present between the styloid process and the hyoid bone, as the name indicates. Next is the stylomandibular ligament. This is the stylomandibular ligament, which connect the styloid process to the mandible bone. Both of these ligaments are attached to the tip of the styloid process. The styloid process, along with the 3 muscles and 2 ligaments, are called the styloid apparatus. Thank you.